right, I'm back with Dr. Mohammed Moursi, Chief of Vascular Surgery, to show us how to apply a tourniquet to stop some serious bleeding. This is going to be some interesting stuff for all of us to learn today.
Yes, and it's very important. Yes, absolutely.
Yeah, so we're talking about the medical school today, and we have a medical student with us.
Conrad,
Hi.
yes.
How are you doing? Thanks for being here.
It's a pleasure to be here.
Absolutely. So I know he's got his work cut out for him ahead for medical school. A lot of young people are interested in becoming doctors.
Yes.
If someone is very young right now, not even going to college yet, maybe in high school, what should they be thinking about?
Yeah, so the first is, you need to understand as much as you can about what it is to be a doctor. I mean, there's so many, saying a doctor is such a big umbrella kind of term. I mean, there's a pediatric neurologist, there's an endocrinologist, a radiologist, there's so many different kinds. So expose yourself to as much of medicine as you can, and obviously through your social media, internet, etc. But you can also go shadow a doctor. Here at UAMS, we're completely available for any student that would like to come. I have many high school students come shadow me and see what I do in clinic and the operating and things like that. So, and then of course, it is a competitive environment, so you have to do as well as you can in school for sure.
Definitely.
It's hard to overcome that. Yes.
Yeah, I know a lot of students want to get into UAMS. So what sets UAMS apart from medical school?
The really great thing about UAMS is it's the only medical school in the state. So it's our medical school, right?
Yeah.
It's what our Kansans think about when we think of medical school and the training. And if you go around the state, most physicians in the state have actually been trained by UAMS. So it's kind of a big family. So it's really it's neat to go to medical school here at UAMS and then go and practice in Arkansas.
Yeah, now, Dr. Moursi, you've been a physician a long time. What do you like best about being a physician?
The taking care of patients, obviously, the gratification of being able to care for patients, but also, you don't know what's coming next. Every disease, every patient is a little bit different, so that's going to change with every day. So that's very intriguing. And but certainly taking care of the satisfaction of taking care of patients, and being a surgeon, being able to do that with your hands is this extra special for me.
Absolutely. Now I know you can't wait to be Dr. Conrad Williams.
Got a while, but I'm very excited.
Yes. What are you most looking forward to about becoming a physician someday?
Well, the reason I came to medical school was to serve people. And the big question, as Dr. Moursi was talking about for high school students, is how best to do that. We all serve people, hairdressers, nurses, and neither of them's better or worse than the other. Just how best do you fit into serving others?
That's awesome.
And that's what I'm looking forward to most.
Yeah, lots of future doctors coming out of UAMS.
Absolutely.
Okay,
very proud of them.
We have a Stop the Bleeding demonstration. So what is this? Let's go ahead and get started.
So, much like we've taught people CPR, and unfortunately in this day and age, there are instances where people have bleeding for a different variety of reasons. So what you need to try to do is figure out how to stop the bleeding, because obviously the medical word is exsanguinate and bleed to the point of being fatal. So the first thing you want to do if you have a point of bleeding is put your finger in it. Okay. So Conrad here is going to show you, get your finger right down on it. The best thing to do is to use a single point as much as you can. Kind of putting a generalized pressure with your hand is less effective. So,
really? So you want to put your finger in it?
Right, yeah. Wow. So let's go ahead, and I know you don't have a glove on, but let's say that's bleeding. So you want to push down. Okay, that's step one. That's what we want to teach. And then step two then would be to use some gauze. So we have these bleeding control kits that have a variety of things in them. They have a tourniquet in them. They have the gauze. And so let's go ahead and take your finger out. Let's say you did a good job. You stopped
good. I stopped it.
Yeah, so now we have another bleeding spot, okay? And so what we're going to do now is we're going to take this gauze here, okay? And this is impregnated with some compounds that will decrease bleeding, okay? They're called hemostatic. Wow. So now we want to go ahead and stuff that in, okay?
So you just start
as much as you
stuffing
can, yeah. Wow. And again, this comes all in these kits.
That's amazing. So he's just furiously stuffing.
Yes.
Well, how do you know how much you've stuffed it up?
All of it.
All of it. You just keep going.
You want to put some in there?
To be deeper than you can see.
Here, I'll do it. Let me try.
Absolutely. Yeah. Just dig all.
There you go.
Oh, it's like I'm on a medical TV show.
And so that not only applies pressure, but then there's that hemostatic agent, which really helps with the bleeding.
Wow. Okay, you were doing a lot better job there than I was.
So now if that doesn't, so that's the first two primary treatments. So the next thing to do then is to actually use a tourniquet, okay? And so the tourniquet we're going to say is high and tight. So obviously put it above where the bleeding is. If it's down here on your wrist, put the tourniquet up in the arm. If it's in your ankle, your lower leg, put the tourniquet on above that. So Conrad will show you here.
Look at that.
And again, this comes in this kit. You notice how he wraps that around it. It's got some Velcro on it. Okay.
And tourniquets, it's amazing. It's kind of an older thing, but it's still.
But it's really, it has clearly been demonstrated to increase survival, okay, especially out in the field. So, you know, UAMS, especially the trauma surgeon at UAMS, they really take a lot of credit here. They've gone out and taught the first responders, the police, even we've gone to churches, and then and the use of this has really decreased mortality. And you can see here, he went ahead and twisted that, and then that decreases the arterial flow to the bleeding spot, and then the bleeding stops, and then you get them to us or to know, medical facility, and then we go from there.
As soon as possible. All right, Dr. Moursi, thank you for being here. And the future Dr. Williams, thank you for being here as well. Yes. Well, if you think all pharmacists do is just dispense your medications, you'd be wrong. Coming up next, we are going to find out about some of the other things that they do for us. Stay with us.